Jacqueline Wainwright, Chief Executive Officer, AiR Healthcare. Welcome to Juicing with Gary.
Gary, thanks for having me. I'm very excited to be here.
It is an honor. It is an honor. Now, wait a second. You're a professional juicer, I understand, at home.
Well, I don't know if I would say professional. We do juice. We have a lot of fun juicing. We have two kids, a 3-year-old and a 7-year-old, and we've tried to find ways to make eating healthy fun. They love the loud noise of the juicer, and they like to put all kinds of different things in there and then taste what comes out.
I made this juice just for you.
You did?
So I picked one of my favorites, raspberries.
Raspberries are delicious.
Now, I also name every one of these. But you know what I call this one? I got your raspberries today.
I like it.
Not the cheap ones from the second grocery store. So in honor of Prince, I thought that I would sing to you, and this is your raspberries today. So that's what we're about to make today. So now, what I need is your help, and be very careful. It's juicy and they're sharp. Get one of those oranges and just cut it right up. We're gonna have a little orange, we're gonna have a little raspberry, little wheatgrass. We've got some tremendous fruits and vegetables in here. They're all healthy. By the way, one of the healthiest of all foods. Let's go with the vegetables. Let's get in the oranges. Let's get some watermelon. We'll probably throw in a few extra blueberries because I like the antioxidants.
Yep.
And then we'll go. So let's get the juicing. And I'll do my best to keep you clean. That's it. Yeah, isn't that beautiful? You did a great job hacking that up, by the way. Now we're gonna add my favorite, the red raspberries.
I feel like we should dance when we put them in after the song you just did.
Well, I'm glad you enjoyed the song. Now watch this. Look at this. 1 second. I think we're there.
Okay.
All right, that's perfect.
Perfect.
All right, and I'd love you to just pour us the juice.
Perfect.
Thank you for being here. Thanks for juicing.
Well, thank you, Gary.
All right, let's go have a conversation.
Cheers.
Cheers. Well, Jackie, thank you for being here today. This is a real honor for us to have you, and I hope you enjoyed the juicing.
Oh, the juicing was great.
Good. We want to know about you. So tell me your story.
Okay, yeah. So I grew up in a family of physicians. So doctors, my dad was an anesthesiologist, my mom an internist, had aunts, uncles, grandparents that were all in healthcare. So healthcare is close to my heart. I feel very connected to caregivers, physicians who have dedicated their lives to helping people. And so I grew up, I'd like to say I grew up in the hospital in a good way. Go in and watch my dad do rounds and look at the babies and so it was a different experience, I think, than most people have with growing up in a hospital or their exposure to healthcare and the health system. And I think that experience has really, made me a little bit who I am today. That compassion and that seeing people at their most vulnerable, looking to others for trust and guidance, that really hit me. And I think I didn't know what I wanted to do with my life. When I was finishing up undergrad, I had the opportunity to take an internship to get a little bit more clinical experience. I was thinking, my family has a lot of history in medicine, so maybe medical school would be the right track for me. So I had the opportunity to get a little bit of clinical experience, and AiR Healthcare was at the time Assistance in Recovery, AiR, and it was fundamentally a group that would take crisis calls from families and provide services to help individuals or families get into treatment. So get to a facility for both substance use disorder or any behavioral health problem, really, depression, anxiety, schizophrenia, and help those families navigate that. And then if the individual didn't want treatment or they couldn't get that person into treatment or they didn't even know where to begin, we would help them navigate that and help get them to a facility and help the family get through it. But along the way, the founder at the time, Andrew Wainwright, who is now my husband, after I left, he asked me on a date, and the rest is sort of history. So I think what's interesting about that is I think our marriage and our family is grounded in this compassion for taking care of others at their most vulnerable, and really seeing a lack of that type of care in the system today, and really just feeling like that needed to be filled. And so dedicating our lives to building an organization that was committed to helping families and individuals live full lives despite having complicated behavioral health problems.
Behavioral health has played such a second fiddle behind healthcare, and nobody wants to talk about it. And it's just so wrong. It's so far. Behavioral health and challenges are at the root of the majority of our illnesses and our diseases. Right?
85%.
85%. So we look at the morbidly obese, non-compliant diabetic, and we're like, look, he's got an overactive fork, he's lazy, he just needs, some nutrition advice, and I'll get him into running, half marathons, and he'll be fine. Until you realize that his wife left him or died, or there was an incident, and now he's drinking or any other substance, and it leads into depression. So
those are scary conversations to have, right? Ones that medical professionals aren't interested in. We need a science-based approach. We need an evidence-based approach, but we need to bring it back in with medical services, right? For so long, behavioral health has been the facility down the road with the locked doors that nobody wants to go to. And when you put it there, what are people supposed to think, right? When it's not worthy of being included and talked about in a hospital setting where people go to get their physical health taken care of, that sends a pretty strong message. One of the first things that we talk about doing is normalizing behavioral health issues. 1 in 4 people has a behavioral health issue, and in this year. So it's like in a lifetime, just about everybody will struggle with some form of behavioral health. And we need to make that a thing that's okay, right? That people understand, because if they can understand that it's not a shameful thing, then maybe they'll be less apprehensive about seeking treatment. Part of what we know is that of those 1 in 4 people that have a problem, 70% of them will never get treatment or never even get diagnosed. And so that's a large number of people that are walking around sick. At least with physical health problems, usually people will make their way to an emergency room or a physician's office, or because there's not as much shame around asking for help for a physical problem. And so we knew that we were going to need to find people and engage them without relying on them to come to us. And so a lot of the models today look at, there's some great programs out there, but they're all inbound call or inbound services. And we had an opportunity to partner with Microsoft a while back and start to leverage some of the really cool things that they were starting to do in healthcare. And so one of those things was to leverage the cloud, to use machine learning and AI to help better understand and predict who in a system was going to need services next. And so we were able to, taking all of the knowledge that we've had over the past 16 years of working with families and understanding the disease from a systematic standpoint, we're able to run claims data. So take in medical, pharmaceutical, eligibility claims data, and find in a population 25 to 30% of the people, which is basically all of the population that's suffering from some kind of behavioral health illness. And we even are able to find those who have never been diagnosed, so there's no medical indicator of having a disease, but we're able to, using patterns of utilization, sometimes a lack of data, meaning there's lots of pharmacy data, but no therapy that goes along with it. So we know that for evidence-based practices, if you're taking a antidepressant, it's only effective if used in combination with some kind of therapeutic intervention. And so we're looking for ways in which we can find those people who would benefit from a clinical intervention and then reaching out and helping them.
So let's talk about the gladiators then. I mean, they're literally doing outbound calls, or they're going after these. What's the receptivity?
So I have to tell you that has been, I think our market is employers. So we work with employers to help improve the health of their workforce. And it's been very interesting to try and educate them as to why it's important for us to call people in their workforce and tell them that would like to enroll them in this program and help them with their mental health problems. They're like, whoa, that's not gonna work here. So we've done a lot of education, but it's not as scary as you think. We had to come up with an approach that was going to work for the employer, but that was going to be successful at engaging the employee and, most importantly, building trust.
So it's one thing to call and say, it looks like you may have some diabetic challenges or prediabetes, and maybe I can help you out, whatever. And everybody's like, oh, sure, I don't want to lose a foot or a limb or go blind, like, oh, sure, help. How does the call go when you're calling around a behavioral health issue? I mean, give me an example. How does this work?
So we've thought a lot about that and tried a lot of different things. Before we even ever entered the space, we thought a lot about how we were going to engage that population. And really, it's about empathy. It's about finding a way to connect with somebody that is maybe miles away on the phone that you've never met. And how do you relate to them immediately? And how do you bond over empathy, right? And so I think we brainstorm, we got all our clinicians in a room, and they're from all different backgrounds. We've got licensed clinical social workers, we've got psychologists, we've got LPCCs and LADCs and eating disorder specialists. So we really tried to bring together a group of individuals that there wasn't anything they couldn't tackle together. And so we got everyone in a room and we started to talk about, what are you frustrated? What can we bond over healthcare about? Like, what can we talk to these families and really get through to them so that they know we're on their side? Because the most important thing in any relationship in which you're going to ask somebody to do things they may not want to do is building trust. And so from the first phone call, we are trying to build trust by empathizing and putting ourselves in that person's shoes. And so when we're talking to mothers that we know are in charge of healthcare for their family, it's, hey, would it be helpful if somebody would schedule appointments for you once in a while? Or is there anything that we can do to take some of that off your plate? What if we could find a pediatrician or an allergy specialist that's closer to your home? Because right now you're traveling 30 miles to get to that person, twice a month. So it was about trying to find ways to help take a little bit off their plate. Because ultimately, caregiver stress and anxiety, life these days is stressful. And there's a lot more stress added just by navigating the healthcare system.
Example of the outcomes, like what's it like to a family? What have you learned?
Yeah, so we call it the good stuff, the stories of what are we doing to change people's lives. And there's lots of those, and I can share some of those. And then the clinical outcomes, how are we reducing the presence of disease or severity of a disease? How are we impacting total health? And then there's the financial outcomes, of course, because they're all related. So when you talk about impact and what kind of impact that this service can have on lives, we've prevented, I want to say just in one employer population, 6 suicides. So there's been patients that, and we only know this because they've then shared through a survey, like an anonymous survey with us, that I had attempted suicide once before, and I received a call from a clinician out of the blue saying, how's your day going? Is there anything that you need? Could I do something for you? And that individual was feeling like the end had come again, and when the clinician had reached out to her, she had decided that maybe she had more to live for. And so it's that kind of stuff that you just, you can't do it.
That's life-changing.
That's life-saving.
That's life-saving.
Yeah.
That's life-saving. With that said, thank you so much, honestly, for the message, for the motivation, and for spending time with me.
Thank you.
Cheers.
Cheers.